News at Sunrise, Dr. Hemmal Kothary, the Chief Medical Officer for Dignity Health for Central California Division. He's been joining us every morning on Sunrise to explain this pandemic and answer questions of ours as well as viewer questions. Dr. Kothary, thank you so much for joining us again, sir.
Well, thank you so much for having me, Maddie.
So President Trump said yesterday that these next few weeks are going to be some of the hardest our country's ever seen as we continue to see cases spike, saying that if we do everything right and continue with restrictions, that we could keep this crisis to 100,000 to 240,000 deaths. What should Kern County residents take away from that statement?
I think we've been saying it from day one. We got to maintain that social distancing. If you're sick, we're encouraging you to stay at home. We're still getting people coming to work when they're sick. So please stay at home. Wash your hands, practice all the hand hygiene things we've talked about. And the big one also is, avoid touching your face.
Do you think people aren't taking this seriously enough?
I really don't. I think there's, a lot of the states are starting to, figure that this is real. We're still seeing several parts of the country that really aren't practicing these safe measures.
What if you have to go out? We do know that there are still essential tasks and essential jobs. You need to go to the grocery store, those sorts of things. Banks are remaining open. When you go out and about, what should you be doing to protect yourself? Should you wear a mask when you are out performing those essential tasks like going to the grocery store? We've seen people doing that, but we've heard that we shouldn't because we wanted to save those masks for our medical professionals. But yesterday, President Trump talked about wearing a scarf instead over your mouth and nose to get protection, but not take away from supplies.
So these are such dynamic times. If you would have asked me this last week, I would have said, don't wear a mask. CDC keeps updating their guidelines, and they're now saying protect yourself as well. We are now starting to see about 25% of the people that come out positive are asymptomatic as well. So the mask is not only to protect you from other people, but we're also seeing that there may be some protection to you as well. And those are brand new guidelines that just came out a day and a half ago.
So what does that mean? Should we go out and buy masks? Should we just use scarves? And what's the proper technique?
So, we're, like you said earlier, we really are trying to save the masks for healthcare providers. We are changing guidelines in the hospital. As of yesterday, we changed them. So we are going to be running low on masks. We're looking for more masks. We're asking the federal government to get us more masks. So in cases of home people, a scarf over your face would be fine. There's a lot of people that are making cloth masks. That's fine as well. But try not to go out and get masks that, the healthcare professionals, the people working on the front lines could be using.
Do you think that people should wear these? The general public should wear these when they go out to the store at this point?
You can, but we caution you because what happens is there's a right way to put on a mask. There's a right way to take off a mask without infecting yourself. And if you don't have those things right, you can actually put yourself at a higher risk. There's a 13% higher risk if you wear a mask and not know how to use it.
What does that come from? How is it more dangerous?
The reason is, so if you have this coronavirus on your hands and you touch the mask, you have now infected the mask. What we tell our healthcare workers is as soon as you do that, you've got to take the mask off and you got to discard it. A lot of the common folk will be out in the grocery stores, will be touching the carts, touching their faces, and keep going. They have now got a higher risk of self-infecting themselves.
So if you do use something like a scarf, you need to come home, remove it, discard it into like the laundry immediately and wash it before we're using it and then wash your hands?
Absolutely. Absolutely right away. And you take it off from the back. You try not to touch your face. We also tell people before you touch the mask, wash your hands before you take it off and get rid of it.
Okay, and then wash it to reuse it. Again, things changing minute by minute. Let's talk a little bit about what's going on in our state right now. Johns Hopkins is reporting 8,558 cases in California this morning. And experts are starting to say that perhaps California's quick action to implement social distancing and shut schools down and other businesses like that are starting to show that they're working and starting to slow the spread. Are you seeing that trend? What does it look like?
So, we're still a couple of weeks behind states like New York. And so I think doing those things will definitely help. So we will really know that if this is working in the next 2 weeks. If we can minimize these cases, the better off we are. So we need to really put an effort into doing these things we've been talking about.
Let's show our current graph of our numbers, if I can get that up on the screen for our viewers really quickly. And it shows that dramatic spike that we've seen in recent days. Yesterday, you know, we went from 70 cases or 71 cases to 101 cases now. And you can see that steep incline on our graph. Do you think that we're going to continue at that same pace over these next few days and weeks here in Kern County?
Unfortunately, I believe we are. You know, and that's where, you know, the social distancing, everything we've talked about becomes even more important. You know, I'd like to say I'm wrong, but you know, everything I've read and all the modelings show us that we will continue on this path for a little bit.
What about testing here locally? Yesterday, the president said he hadn't heard of testing shortages, but we are getting viewers who are telling us they have the symptoms. They go to a local testing site and they are told, no, we're not going to give you a test. Are there enough tests here in Kern County? Are we running out?
So they're sending tests to areas that are hit the hardest first. And Kern County is still not considered a hotspot yet. So we are getting tests. We're getting them extremely slow. What I will tell you, viewers, is Dignity Health has partnered with a company called Amwell. And you can download an app onto your iPhone or your any of your handheld devices. It's called WellCare. Virtual Care. If you download that, you can talk to a doctor online in real time and tell them your symptoms. And then if they think you need to be tested, we actually have a clinic right off of Stockdale Highway. It's 9500 Stockdale Highway. It's one of the Dignity clinics. You can go in there, make an appointment, and they will test you.
All right, we're running out of time, but really quickly here. If you're showing mild symptoms, but they are indeed COVID-19 symptoms, still though, they are mild, should you go try and get a test?
We would say no. We would just tell you to just self-isolate. Self-quarantine at home. And the reason for that is if you do have it, just quarantine yourself. We don't have any of it. We have nothing else to offer you at this time. If you don't need to be in the hospital, stay at home.
All right, Dr. Hemmal Kothary, we thank you so much, sir. And Dr. Kothary will join us again tomorrow morning on Sunrise. Continue to send us your viewer questions, and we will get to as many of them as we can. Thank you, Dr. Kothary.
Thank you.
We'll be right back.